everyone. My name is Clarissa. We are Group 1. We are here to present to you our demo. But first, let me introduce my group members. They are Catherine Tamayo, Ginalyn Benitez, Alexandra Quinto, and Teddy Kian Consol. So, what is postural drainage? Postural drainage is an air clearance technique that helps people with COPD. COPD stands for chronic obstructive pulmonary disease. To clear mucus from their lungs, so the lungs consist of 5 lobes, 3 on the right side and 2 on the left side of the chest cavity. So each lobe is further divided into segments. So the goal of postural drainage is to help to drain the mucus from each on these lobes into the larger airways, so it can be cupped up more readily. So it uses a combination of a chest percussion. So a clapping movement is performed with a cupped hands and a vibration and a vibrating movement done with the flat hands. So the postural drainage is generally performed for 3 to 5 minutes on each segment. During this time, the patient being treated should take slow, deep breaths followed by a vigorous coughing to help to clear the mucus. Let me first assess our patient. Number 1, assessment.
Good day, sir. I am Catherine Tamayo and I will be your nurse for today. So can you please state your name and your date of birth?
I'm Amy Cruz, and I was born on May 30, 1963.
Okay, sir. So, sir, meron po ba kayong history ng loss of consciousness?
Wala,
Meron po ba kayong history ng muscle weakness?
wala po.
Panghina ng muscle. Okay, sir. Check po natin yun. Inhale po. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay, sir, check po natin BP ninyo. One 110. Okay, sir, next po yung oxygen level po ninyo. Okay po.
For planning, identify the expected outcomes to remove the bronchial secretions, to improve the ventilation and to increase the efficiency of the respiratory muscle. Lastly, explain the patient of the procedure like, good day, sir. The position to facilitate is the removal of the secretion with gravity. And the third is the implementation.
First, provide privacy. Ensuring privacy can promote more effective communication between the therapist and the patient, which is essential for quality of care. It enhances autonomy and preventing embarrassment and discrimination. Second is hand hygiene. Keeping hands clean is one of the most important steps we can take to avoid getting sick and spreading germs to others. For proper hand washing, wet your hands with clean running water and apply soap. Lather your hands by rubbing them together with the soap. Scrub your hands for at least 30 seconds. And after scrubbing your hands for at least 30 seconds, now rinse your hands with well under clean running water. Third, apply gloves. Gloves can help keep your hands clean and lessen your chance of getting germs that can make you sick. You should wear gloves for this sort of contact, even if a patient seems healthy and has no signs of any germs. And then, used findings from physical assessment and chest x-ray films to select the congested area for drainage. Now, assist patient to appropriate position. Place pillows for support and comfort. And after that, drape the patient appropriately. And after assisting the patient, we are now going to start performing the postural drainage, starting with upper lobe's apical segment, which will be shown and demonstrated by our group leader, Miss Clarissa Versosa.
The first postural drainage is the upper lobe's apical segment anterior. So first, positioning of the patient. So the patient leans back at 33 degrees seated. The patient sat in a comfortable position against a pillow on the headboard, 2 pillows, or use help if needed to make sure the patient is properly guarded. To start, cupping at the back for 2 to 3 minutes. Assuming already done for 2 to 3 minutes. After that, encourage the patient to take a deep breath. Inhale, exhale. And to cup during the precaution, after perform 2 to 3 repetition of shaking and force directed toward the ground. If there are no secretion to expel, the patient perform cup to remove. If there are no secretion to expel or after the patient has cupped, the cycle of a cupping and vibration can be repeated. So treatment for the segment stop when it's no longer productive. The second posterior drainage is the upper lobe's posterior segment. So positioning the patient. So the patients lean forward at 30 degrees seated. Make sure the patient is guarded for safety. On the side of the bed and lean over a pillow with his underarms, so dangling. As before, percussion and vibrating with both hands over the upper back on a both and the right and left side. Assuming already done for 2 to 3 minutes, so the cupping provided for 2 to 3 minutes. So cupping is followed by 2 to 3 minutes repetition of shaking or vibration. After the procedure, if there are secretion to expel, PT performs cup to remove. If there are no secretion to expel or after the patient has cup cycles, a cupping and vibration can be repeated. So treatment for the segment stop when it's no longer productive.
For the next position is the upper lobe anterior. The bed must flat, then position the patient in supine, then clap the patient between clavicle and the nipple area. Then start cupping for 2 to 3 minutes. Then followed by 2 to 3 repetition of shaking or vibration. Sir, kindly deep breath in and then exhale. Once more, deep breath in and then exhale. For the next position is the right middle lobe. The foot must elevated 16 inches. Then the patient lies head down. Then on back, rotated 1/4 turn to left. Then the knees are flexed. Then start cupping over right nipple area. Then start for cupping in 2 to 3 minutes. Then followed by 2 to 3 repetition of shaking or vibration. Sir, kindly deep breath in, then exhale. Once more, deep breath in, then exhale.
Lower lobes posterior basal segment. For this position, the person will lie on his or her stomach with hips and legs elevated on pillows. The therapist will percuss and vibrate the lower part of the back over the left and right sides of the spine, taking care to avoid the spine and the lower ribs. And now we're now going to percuss the left and right side of the patient for 2 to 3 minutes. After 2 to 3 minutes of percussion, we are now going to vibrate. If there are no secretions to expel, patient performs cuff to remove. If there are no secretions to expel or after the patient has coughed, cycle of coughing and vibrations can be repeated. Treatment for the segment stops when it's no longer productive. And for lower lobes lateral basal segment, for this position, the person will lie on the left side, leaning forward, one of a quarter, a turn with hips and legs elevated on pillows. The top leg may be on top of a pillow and flex for patient support and comfort. In this part, we are now going to percuss and vibrate. And after that, the patient may rotate from the right side to the left. And we will repeat the percussion and the vibration. If there are no secretions to expel, patient performs cough to remove. If there are no secretions to expel or after the patient has coughed, cycle of coughing and vibrations can be repeated. Treatment for the segment stops when it's no longer productive.
Next position position is lower lobe's anterior basal segments. To start, position the patient. Foot of the bed should be elevated for about 20 inches. Next is the arm should be overhead. Cupping is performed for 2 to 3 minutes. Patient should inhale deeply after 2 to 3 minutes. Sir, inhale, exhale. Inhale, exhale. Perform shaking during exhale. Repeat for 2 to 3 minutes. If there are no secretions to expel, patient performs cough to remove. If there are no secretions to expel or after the patient has coughed, cycle of coughing and vibrations can be repeated. Treatment for the segment stop when it's no longer productive. Next postural drainage position is left upper lobe lingular segment. To start, position the patient on the right side. Rotate full trunk 1/4 turn backward. Next is to elevate the foot of the bed. Perform cupping for 2 to 3 minutes. After 2 to 3 minutes, the patient should inhale deeply. Sir, inhale, exhale. Inhale, exhale. Perform shaking during exhale. Repeat 2 to 3 repetitions. If there are no secretions to expel, patient performs cough to remove. If there are no secretions to expel, after the patient has coughed, cycle of coughing and vibrations can be repeated. Treatment for this segment stop when it's no longer productive.
For the final position, which is the lower lobe superior segment, first thing to do is positioning of the patient. The patient will lie flat, his stomach on a bed. And after that, start to percuss over the middle of the back at the tip of the scapula bilaterally. It is done for at least 2 to 3 minutes. And after that, encourage patient to take a deep breath and to cough during percussion. Okay, Mr. Cruz, take a deep breath. And then followed by 2 to 3 minutes repetition of vibrating. If there are secretions to expel, patient performs cough to remove. If there are no secretions to expel or after the patient has coughed, cycle of percussion and vibrations can be repeated. Treatment for the segment stop when it's no longer productive.
After that, have the patient take sips of water, repeat steps 3 to 8, make sure that it doesn't exceed to 39 to 60 minutes. Offer or assist the patient with oral hygiene. And lastly, remove the gloves safely and perform hand hygiene.
For the evaluation, sculpted lung field, inspected character and amount of sputum, reviewed diagnostic reports, vital sign and pulse oximeter is normal, ask patient to explain importance of positioning. The best time to do postural drainage is either before a meal or an hour and a half after a meal. When your stomach is emptiest, use one of the following positions: sitting, lying on your back, stomach, or side. Postural drainage use gravity to help move mucus from the lungs up to the throat. The person lies or sits in various positions so the part of the lung to be drained is as high as possible. That part of the lung is then drained using percussion, vibration, and gravity. Then the last one is identify the unexpected outcomes. Maintain a patient airway by mobilizing secretions into larger airway where they can be coughed or suctioned. Increase respiratory gas exchange by increasing the available surface area at the alveolar level. Decrease the incidence of respiratory infection. Compare patient respiratory assessment pre and post postural drainage to identify the effect of postural drainage.